Hello everyone, this is Dr. Annie Pranutha, Consultant Obstetrician and Gynecologist at Birthright by Rainbow Hospitals, Banjara Hills. Today we will discuss about an important topic called gonorrhea in women. We should all be aware that gonorrhea is a sexually transmitted disease which can affect both men and women. The importance of this disease lies in the fact that many women, almost 50%, remain asymptomatic and they may be carriers of this infection and they can actually affect their sexual partners. So the mode of transmission of this is by sexual contact. The second mode of transmission is that if a mother is infected, this disease can be transmitted to the baby during birth. Now, what we should be worried about in this disease is that if it is left untreated, it can result in certain complications. Because this disease is known to affect the genital organs, mainly the female genitalia, the infection can be transmitted upwards, that is ascending infection, and it can affect other parts of the pelvis like uterus, it can affect the fallopian tubes and other pelvic organs. So what happens if the disease spreads to the other pelvic organs? It can result in inflammation or infection, and which is otherwise termed as pelvic inflammatory disease, which can damage the uterus, it can damage the tubes. Now once the tubes are damaged, there is a very high possibility that women are affected with infertility, which means difficulty in conceiving. Also, if they conceive, there is a risk that the embryo can grow in an abnormal place, that is tubal pregnancy or an ectopic pregnancy. So it's very important that these complications should be kept in mind. One more thing is, if a woman is affected, there is a very high chance that because most women are asymptomatic, as I said, these infections can be transmitted to their sexual partners. Also, there is a very high risk of being affected by other sexually transmitted disease, which is HIV, which can result in acquired immunodeficiency syndrome or otherwise called as AIDS. So who are at risk? As I said, those who have sexual partners, who are multiple sexual partners, already affected sexual partners, and those who do not seek medical help, or those who are not regularly being screened, practicing unsafe sex without using any protection. So what are the symptoms that most women can have is, first thing, they can have an abnormal vaginal discharge. It can be a watery discharge, it can be a yellowish, greenish discharge, other symptoms like itching or a vaginal irritation. Sometimes they can present with abnormal vaginal menstrual bleeding. So they can have bleeding between intercourses, in between menstrual cycles. They can have irregular or a heavy menstrual flow. Most women often present with urinary symptoms. So they can have burning urination or pain while urinating, which is most often confused with a urinary tract infection. And some of them can have a lower abdominal or a pelvic pain. So what is more important is, when you are suspecting of this infection, when you have these symptoms, if you are in doubt that your partner is affected, it is important to seek medical help. What your doctor will do is, they will take sample of the discharge from the cervix and send it for culture to the lab, or it can also be diagnosed through a simple urinary test. If you are tested positive for this disease, you will be treated by the use of antibiotics. It is important to know that CDC also recommends treating the affected partner also, or if the partner is unaffected, if they are diagnosed as positive, it is important to treat both the partners and also abstain from sexual intercourse for at least 3 weeks from the diagnosis of the disease. Now, as I said, even an affected mother can transmit this infection to the newborn baby during the childbirth. It is important that women in pregnancy also be screened for this disease, especially those who have abnormal vaginal discharge. Because untreated, it can affect the health of the baby, it can cause serious illness, it can also cause blindness in newborn babies. How can this be prevented? That is most important. One thing is, avoid having multiple sexual partners. Second thing, annual screening for gonorrhea is recommended in all sexually active teenagers and young adults because they are known to be at risk. And lastly, it is important to seek medical help whenever you feel that you have symptoms. If you are symptomless but your partner is affected, it is important to seek medical help, meet your healthcare provider. Important concern is that gonorrhea is these days becoming resistant to many antibiotics. So there is a growing concern about the effective treatment of this disease. So the earlier, the better. Thank you very much.